One frustration that I've had over the past couple of weeks is getting data, and I know some of our community members have felt the same way, and we've seen some of that in our social media. But for instance, the CDC, they have not done a release with their weekly COVID data tracker since before Christmas, and they won't do another update until January 7. So that's been a frustration. And with the holidays, Department of Health has also had some lags in some of their data. So first of all, I'll apologize to our community for not getting the information in a timely manner, but also to explain that there are things that are out of our control, and we're working hard to give you the information that you're looking for. This shows the Omicron wave, and I put a couple other countries up here just to put things into perspective. The one thing that you'll see on this slide is, all these case rate curves are very steep. Things go up very quickly. But if you look at South Africa, the case rates also come down fairly quickly. So, we're definitely in the upswing of this Omicron surge. And looking at the South Africa case rate curve, this is hopefully only going to be about a 6 or 8 week ordeal, but time will tell. We'll just have to see. This is just a closer look at our case rate curve. It looks like the case rate from a national level is going to surpass what we've seen with the previous waves. The one thing that the CDC did update on December 29 was this heat map. And all of you can probably recall when the Delta wave transmission was bad, it was like 94% of the counties were in high transmission, and then we dropped down to the 70s, and now we're back up into the 90s. Also, we can recall that the Southeast was mostly yellow and orange. And even a couple of weeks ago, we started seeing Washington State was getting more orange, including Walla Walla. Walla Walla was in a substantial rate. And then Waukegan and Klickitat counties were in the moderate transmission rate. Now things have changed in our state as well, and I'll get to that in a second here. So looking at the Washington State case rate curve, the 14-day case rate curve shows that the cases are going up pretty precipitously. If you separate Eastern and Western Washington, you can see that currently the precipitous rise is mostly driven by the western part of the state. The eastern Washington counties were less than 100 on this December 29, and the western counties were 3 times higher at that time. And this graph here, this is the eastern and western Washington, and I added these case rate curves, and you can see it's really driven by Pierce County, King County, Thurston County, these bigger counties with really high numbers. And if you can see Walla Walla down there, 308, and Pierce County 913. So some counties are 3 times higher than Walla Walla County, and these are highly vaccinated counties as well. I think King County is the second highest vaccinated county in the state. So we're gonna see cases really start escalating. Up until this week, it looks like hospitalizations weren't going up, but the incomplete data is suggesting that hospitalizations are starting to go up. But the data doesn't show that deaths are going up, but that the cases go up first, and then the hospitalizations go up, and then the death rates go up. So we probably will see an uptick in these. I know there's a lot of news reports that Omicron potentially is less dangerous. You're 30 to 70% less likely to go to the hospital. But we're mostly just concerned about the sheer increased numbers in cases. So even if your chances from a percentage basis is less, if the overall volume of numbers is so high, that does give us some concern. Looking at the Walla Walla case rate curves, we're in the moderate transmission rate. And if you look at the 7-day case rate curve, we're starting to see cases tick up. We're averaging, I believe, about, like over the weekend, for instance, about 40 cases a day. And there will be a little bit of a delay in reconciling these numbers as one of the state systems, the WDRS system, went down this morning. So I apologize to our community if there's a little delay in reporting some of this, but some of our tools are not functioning properly, but we'll get that accurate information as soon as we can. Our testing volume last week increased, and this week it sustained that level of increase. I think we're getting down to around 30 to 40 a day a couple of weeks ago, and now we're at about 75 tests a day. We anticipate that might increase a little bit more because last week, I think the clinic was only open, the testing clinic was only open 3 days, and now it'll get back to 5 days per week. With our vaccines, we're still mostly doing boosters. Total, we did about 500 shots last week. And starting this week on January 6th, Thursday, our new cadence for the Southgate Clinic will be Thursday, Friday, Saturday. And we're just kind of basing this on volume. And I know we talked about this last week, Commissioner Tompkins, but you asked us to make sure we have clinics available every week. But I think our return on effort was not great for a while, but we never knew about the demand. The mandates were coming down the pike, boosters were coming down the pike. So we kind of overdid it, but now we're trying to focus more on just trying to match our effort to demand, and we will expand and contract these clinics as needed. And we still continue this effort of trying to get other community partners to give vaccines as well, more points of entry into getting vaccinated. And we also continue to have our mobile homebound units and other mobile clinics out in the community. Also, there's news about new CDC guidelines, and I don't want to comment on this too much because it's in a state of flux. Even since these were announced, there have been revisions, and DOH, Washington State DOH has made some revisions. So basically, they did change the duration of how long people will have to isolate or quarantine. We're going to try to find the most up-to-date information on this and push this out on our social media, but it's going to change. It's going to probably take a week or so before it lands on where it's going to land. And so I hate to get too detailed about this information at this time. But if anyone does have questions, I would, for now, just ask them to reference the CDC guidelines and go by those guidelines.